So hi, my name is Tejas Mehta. I'm one of the interventional cardiologists from OhioHealth Heart and Vascular Physicians, and I practice primarily out of Grant and Grady. And what we wanted to do today was bring you a case to highlight some important decisions that were made in the process of seeing this patient out in the field for their complaints of chest pain. So what we're going to do is we're going to use an example of a patient who was brought in by Jackson Township, and the patient called in with complaints of chest pain, and I do actually have the timeline, so we have exact numbers and times. So at 7:04, the squad was dispatched. They arrived at the patient at 7:15. They got the initial EKG at 7:19, and that EKG was transmitted to our facility. And specifically, when squads transmit EKGs to Grant, those EKGs go not only to the emergency department, but they also come to all of our smartphones. So all the interventional cardiologists do get the EKG simultaneously as the ER as well as the cath lab. And based on that transmission at 7:19, we were all able to see that EKG and see that it clearly was an inferior MI. So here's going to be that EKG that was transmitted, and you can clearly see the ST elevation in the inferior leads. So based on this, we felt pretty confident with the story of chest pain and with this EKG on all of our iPhones that this was going to be a great patient who could come straight to the hospital and come straight to the cath lab with a minimal delay in the ER. So that ultimately is what happened, in that there was a pre-hospital STEMI alert called. We basically, here in the cath lab, were waiting for him to arrive at Grant. He arrived at Grant specifically at 7:40, had a 1-minute pit stop in the ER, and then ultimately came to the cath lab at 7:43. So from hitting the door at Grant and getting to the cath lab was 3 minutes. And I would say that the reason for that is because you guys transmit EKGs. So the one thing that I always like to speak about often is to transmit EKGs, because it makes it easier for us to kind of take care of the patient in a more rapid fashion. So what I was going to do is kind of show you the angiogram, and here's going to be the cath on that particular patient. It was done at 7 in the morning. Like I said, he arrived to the cath lab at 7:43. Procedure starts at 7:47, and here you can see is this heart cath, where this STEMI was actually done by Dr. Devakis, one of my partners, where the catheter plugs into the right coronary, the dye fills, and then the dye stops all of a sudden. So I'll kind of loop that for you. And so clearly this person has 100% occlusion of the right coronary artery. And what I'll do is kind of fast forward to what happened. And so through a series of wires and balloons and stents, he ultimately did reperfuse his entire right coronary artery. I got a lot of pictures here. And so at the very end of the day, this was the final result, where you can see at the site of 100% occlusion right here, now the vessel's all the way open. And so when you look at this person's time, his door to balloon time was 18 minutes. And I think that was because we had that pre-hospital STEMI EKG. And ultimately, when you look at his first medical contact to balloon time, it was 43 minutes, which obviously is an outstanding result. And I just want to congratulate Jackson for doing the right thing and transmitting that EKG and then bringing it straight to a tertiary care facility where that could, this whole sequence of events could have happened without a delay in his care. And so that's really the small case we wanted to show today. If there are any questions, don't hesitate to contact us. But that's it. That was a STEMI from Grant.